Hello, everybody. This is Gary. Today is November 29th, 2021. It's 5 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia vlog entry for today. Today, I wanted to talk about health insurance and chronic mental illness. I have schizophrenia, which is a chronic lifelong illness, and I live in the United States because mental illness, psychotic mental illness, is a lifelong illness. I need health insurance that covers me for my entire life. The first time I was diagnosed with having a psychosis. And for me, that means Medicaid and Medicare, which means government bureaucracy and trying to manage that bureaucracy. I got a letter last week from New York State Medicaid Office, Department of Health, saying that they're reviewing my payments for Medicaid and what they're paying to my psychiatrist and my medical doctors for my medical care. So I have to call the state health department tomorrow and have a form mailed to my doctor so they can fill out an extension of my Medicaid benefits, because I have a yearly limit on how many doctor visits I can get, how many pharmacy visits I get, how many therapy visits I get, how many psychiatric visits I get, and how many hospitalization visits I get. I also have Medicare, which is a different federal program for people with disabilities. I get Social Security disability insurance benefits through the United States Department Administration for the Social Security. So I have to navigate the bureaucracy of the government and its two health insurance programs, Medicare and Medicaid, for my health insurance, to pay for my treatments, my medical treatments, whether it's my medical doctor, my general practitioner, my urologist, my cardiologist, my psychiatrist. All of these things are going to be reviewed by Medicaid. Medicaid also pays partly for my ambulance rides when I go to the psychiatric emergency room, or if I go to the emergency room for medical reasons. So my doctor has to fill out a form and ask for extensions on how many benefits I'm allowed this year because I'm reaching my limit. There are no limits on my Medicare, so I'm not dealing with Medicare right now. I mean, they pay my bills, but they don't have yearly limits on psychiatric visits and medical doctor visits and things like that. They obviously watch out for insurance fraud, which I'm not committing to insurance fraud, so I don't have to worry about that. But New York State Medicaid is reviewing my Medicaid case and how many visits I get to see my psychiatrist, how many pharmacy visits I get on my medications. Most of my medications are covered by Medicare and not Medicaid, but one of my prescriptions is covered by Medicaid, and I need to get an upper limit increase on how many pharmacy visits I'm allowed for one of my medications, which is my nicotine lozenges, because I'm still trying to quit smoking. Nicotine lozenges are paid for by Medicaid, not by Medicare. Medicare doesn't pay for any medications that you can buy over the counter, and in New York State, you can buy nicotine lozenges over the counter, but they're very expensive. So my Medicaid pays for them. But anyways, I have to fill out some bureaucratic forms. My doctor has to fill out some bureaucratic forms to continue my health insurance. Medicare pays 80% of my bills. Medicaid pays the other 20%. When I get an ambulance ride or a doctor's visit or an emergency room visit or hospitalization, it's broken down by 80% and 20%. I also have to pay monthly Medicare premiums, which are deducted from my Social Security checks. And for everybody on Social Security in the United States, our Medicare premiums are going up by $30 a month. from $141 to $171 per month, and they deduct that out of my Social Security benefits. So there's a lot of bureaucracy involved with having a chronic mental illness like schizophrenia, schizoaffective disorder, any psychotic disorder like bipolar disorder, schizotypal personality disorder, um, any kind of chronic severe mental illness usually means in the United States that you need government insurance, because private insurance has very limited coverage in the United States for severe chronic mental illness. And I've been on Social Security disability in one form or another since I turned, I don't know, about the age of 19, and I just turned 56. If I didn't have government insurance, I would not be able to pay for my medications and my psychotherapy, especially my psychiatric medications. Um, so I have Medicare and Medicaid, and I have to navigate a very large bureaucracy of Medicare and Medicaid for all my psychiatric care, plus any medical care that I have. Um, this year I had severe medical problems with the inability to urinate. I was wearing a urinary catheter into my bladder for 4 months. I had 2 surgeries on my prostate and on my urinary bladder. The issue was resolved through the surgery, but that was all covered by Medicare and Medicaid, including cab rides, taxi rides to my medical appointments, to my urologist, and to my surgeon. Um, it's all very complicated in the United States. Navigating private insurance and Medicare and Medicaid, it's all very complicated. Medicare covers all of my medications except for the nicotine lozenges, and it's called Medicare Part D. It covers prescriptions, and in the United States, Medicare Part D is run by private health insurance companies. Even though Medicare Part D is a government program, it's administered by individual private medical insurance companies. And I have to navigate that along with the government part of the insurance to get all my prescriptions covered, both medical and psychiatric. Um, my Medicare Part D health insurance, they're changing their name and they're changing some of their rules and regulations starting in January 2022. So I have to navigate that bureaucracy and the change in my private Medicare Part D prescription coverage. It's all very complicated, and it's really, really difficult to navigate this stuff. And I'm basically doing it on my own. But I think I'll be able to get it resolved one way or the other. But I just wanted to do a brief video on how complicated medical insurance and mental illness can be in the United States, whether you have government insurance or private insurance. Private insurance in the United States usually has very, very limited coverage, if any, for mental health problems. When I was 18, my father had private medical insurance that covered me for medical reasons, but didn't cover anything for psychiatric problems. And that's why I had to apply for Medicaid and Medicare, which I'm now on right now. So like, comment, share, subscribe, share my videos on social media, and press the notification bell when you want to know when I put out new videos. And if you want me to do a video on a specific topic, let me know in the comment section.